created. It's the whole concept of communication. And in the NHS, one of the things we seem to have lost is the ability to do so. I think the worry of governance has stopped us from doing simple things like a general practitioner talking to a specialist and other way around. And we have seemed to have wrapped ourselves in sort of archaic ways of communication. So this platform gives the opportunity to look at possibly having that communication back to the olden days where you can just talk to your colleague about a patient, but without the fear of governance behind it. And I think that's where the exciting potential lies.
What medCrowd is providing, first of all, is something that comes very naturally to clinicians and people working in patient care, the ability to communicate. But it allows us to do so in a way that's much more kind of rich and safer than it is at the moment. So instead of having one-to-one conversations using different platforms, medCrowd allows me to securely contact a number of different trusted colleagues and be able to discuss a patient confidentially and securely and help move their care forward.
There's the potential for doctors all around the world to connect and collaborate on the same cases. I think the efficiency savings that you'll see, doctors making notes and trying to talk to each other over phones and bleeps, it's really inefficient and it takes a long time for things to get done often. So technology like medCrowd, it's rapid, it connects people really quickly. I think loads can get done a lot quicker and more efficiently.
By giving the people that need to know the right information when they need it to make important decisions.
Because if you think about it, what we are dependent on, referral systems, people being sent to hospitals, we're trying to get to a system whereby if a patient is in front of you, you cut through all the time lag, you cut through all the bureaucracy. That is one thing. And the other thing is communication between healthcare professionals inside a hospital, moving away from things like pagers. Simplistic ways. In 2018, it should be a no-brainer, but as ever in the NHS, it takes time. So it does offer the possibility of doing that better than where we are at the moment.
Person's data, a person's personal data, particularly their medical data, is so important to their ongoing care and has such a high value that it is our responsibility to take as good care of that as possible. Now, by complying with data regulations, we can be assured that it's going to be cared from start to finish and stored in a way that's going to stop it being shared with people that maybe don't have the person's best interests at heart.
Well, I think the Facebook story tells its own story. I mean, it's all around us. People are worried about their data. There's some good surveys saying that people are more comfortable about giving their data to the bank rather than the NHS. Because to be honest, we haven't really covered ourselves in glory while doing that. So I think it becomes more important that if you say to a patient, I would like your data, that we are able to handle it properly rather than it being open to access, which understandably is not what anybody wants. This platform gives the possibility of doing that, and thereby that's something which should improve care, and with the governance security around it, it probably assures the healthcare professionals to be more open as well.